In this process, trying to understand the mechanism of action of these fabrics, we went ahead and reviewed the literature, and there is a concept that is called the neurophysiology of comfort. That is the psychological evaluation of what comfort represents to the patient. And there are several authors as depicted here. However, what caught my attention was a study that is called a design-oriented fabric comfort model that is currently being worked by the Georgia Tech, North Carolina State University, and Auburn University since 2005 to the present time. And they've made some very interesting laboratory measurements. And they have measured tactile, that means elasticity, the stretch, the compressive power, softness, durability, smell and cleanliness of the fabric. They've taken another step by analyzing the moisture as far as absorption, wicking, drying, and even the thermal characteristics of this material, such as insulation and permeability. Well, all these laboratory findings really have no significance unless you apply them to a clinical experience. And that's where we came on board. The Marena group contacted us to see if we were able to offer some clinical experience trying to evaluate the current material with the experimental material. And for us, the experimental was going to be the Marena fabric. And we developed a protocol with three very important questions. Number one, are there differences in how patients perceive the comfort and wearability of compression garments after liposuction? We don't know. Number two, how important is the type of fabric and knitting process used? And number three, do these differences result in better patient compliance and improve our clinical outcomes? So we went ahead and designed our protocol with materials and methods, and all patients were part of the group practice of the Aesthetic Center for Plastic Surgery in Houston. They were all volunteers, and they all agreed to sign a consent form. All patients, N equal 50, had a suction lipectomy of the abdomen and thighs. 20 patients, that is 40%, included other minor liposuction areas such as the face, the neck, back, knees, and arms. All patients were operated in a fully accredited outpatient facility. That means a Quad A facility with a board certified anesthesiologist and all the characteristics that I'm sure you're all familiar of an accredited facility. They all underwent general anesthesia, were discharged at 23 hours post-op. The age of these patients ranged from 17 to 39 with a mean of 32. The weight of the patients ranged between 138 and 170 pounds with a mean of 159. Each patient received 2 garments that from now on we're going to call them as the black garment and the beige garment, so that the patient had no preference and no information on the characteristics of each one of these garments. The experimental, I repeat, will be black color. It will be the Marena garment made out of the ComfortWear fabric, and the control was our standard PowerNet fabric by Veronique, and it was in beige color. If we take a look at the microscopic analysis of the fabric core structure, I'm going to just emphasize on this. Take a look at these 2 pictures. The ComfortWear is elastic soft lycra yarns fused together to form a floating spandex grid. Tacted nylon loosely laid in, as you can see right over here. Compare this to the picture on the right, in which there's a lot of space in between those loops, and the PowerNet is non-elastic nylon, yarns tightly wrapped around elastic spandex yarns. So this is basically the microscopic difference in the core structure of the 2 fabrics. Now, under the naked eye, you can see the experimental, that means the Marena fabric right here on the left, and you can see the control, which was Veronique, on the right side. Patients had to change garments every 24 hours for a period of 30 days. That means 4 weeks. They had to fill out a study registry and an informed consent. Photographic documentation was taken before and after treatment. And they had to complete a 35-question evaluation, progress reports, office visits, and telephone interviews. The manufacturer provided the experimental garment, that was Marena, and our center, ACPS, provided the control garment for every single patient. Now, the surgical candidates had to fit the following criteria, and if you take a look at the criteria, it's very stringent. Patients had to wear comfortably a garment size large. The weight of the patient had to vary between 135 and 170 pounds. The measurement of the ribs between 32 and 36 inches. The waist between 30 and 33 inches. The hip between 40 and 43, and the thighs between 12 and 13 inches. In addition, patients had to be willing to wear continuously a full body girdle below the knee and with suspenders. And this is the picture, again, of the patients with the experimental garment on the left and the control on the right. A lateral view and a back view. Now, the assessment. For us, it was very important for the assessment to be taking place by the patient. Most of the studies are conducted by the surgeons. Sometimes they involve, the operating room personnel. But we thought this was very important that the patient be the one that gives us how they felt in the selection process, in evaluating each one of these garments. And we have provided some samples of each one of these two garments for you to touch them and feel them, in addition to a handout that you would be getting or have received. So, under the naked eye, take a look and feel one garment and the other.